Hello, welcome to Caregiver Corner. My name is Laura Spradley. I'm the Outreach Coordinator for the Arkansas Geriatric Education Collaborative, and as you know, that's a big long name for AGEC, what we call ourselves. And we are so proud to still be with y'all during this pandemic, and we're so excited that y'all continue to follow us and log in on Tuesdays and learn new tips for caregivers. And really, they're good for anybody, but we like to particularly focus on our caregivers on Tuesdays. So today we're going to talk about safely using hand sanitizers, and I'm going to share my screen with you and talk about just hand sanitizing. We've talked about hand washing in the past, and we briefly went over if you can't use soap and water to use hand sanitizers. But I thought I'd go back over that again today just to refresh everyone's memory. All right, so the ultimate goal is to obviously help and to stop the spread of COVID-19, okay? So we're gonna wash our hands regularly, frequently. We're gonna use soap and water, sing to yourselves the birthday song twice, they say, to really, scrub your hands well. But if soap and water are not available, the CDC recommends that we use an alcohol rubbed-based hand sanitizer that contains 60% or more alcohol, okay, and that's to help kill off the bacteria and germs, okay, and use an alcohol-based hand sanitizer that contains either ethanol or ethyl alcohol. So when you read the label, you'll be able to see that, okay. And again, the goal is to reduce the pathogens that may be present on our hands if we can't get to soap and water. All right, the alcohol in these products works best when it's rubbed onto our hands, okay, liberally, all right? Get between your fingers, on the tops of your hands, bottoms of each hand, and again, do it for 20 or 30 seconds. Work around your rings, make sure you're really using it well. Do not wipe it off or rinse it off, okay? Let it dry, all right? If your hands would happen to be visibly dirty or greasy, please try to use soap and water as soon as you can, okay? That's just a little summary of that. Hand sanitizers are considered drugs, okay? I did not know that until I was doing my research on this little topic. The sanitizers are regulated as over-the-counter items from the FDA, and so we need to read and follow the labels and use them as directed on the label. Store them out of the reach of children, of course, and also out of the reach of your pets, all right? And if children are going to be using them, use it in your presence, okay? So you can be assured that none gets in their mouth, that they don't accidentally squirt any in or try to drink it, okay? No one should ever drink or consume hand sanitizer, and never let your pets consume it, okay? The FDA does recommend, from what I can tell in the reading, that we not make our own hand sanitizer. Number one, if it's incorrectly made, it could be ineffective, or if it's inappropriately made, it could burn us. So they do recognize that there is a shortage of hand sanitizers. I have noticed that that's gotten better though. The shelves are being, you see them fully stocked, or at least available nowadays, okay? So but the FDA is fully aware of the shortages, and they're working to keep those shelves stocked with hand sanitizers, okay? If you experience a severe reaction from a hand sanitizer, call your doctor and check that out, okay? You might have had some kind of a sensitive experience or more serious reaction to a hand sanitizer, and we don't want you to suffer. Okay, if you should run across a hand sanitizer that you purchased during this time that has a methanol-based alcohol in it, the FDA is recommending that we don't use those, okay? But most commercially made sanitizers do contain that ethanol or isopropyl type alcohol in the product, okay? You can always go to the FDA's website or CDC and check out your brand and what's in it, okay? But do not use the hand sanitizers that would contain any methanol. I know there was something that came out across the news a few weeks ago about those maybe being produced like in Mexico. So read your labels and pay attention. No methanol. All right, check your sanitizers, like I said, against the FDA's testing and manufacturing recall list if you have any questions. Better to be safe than sorry, okay? If you should have a child or someone accidentally ingest, anyone really, ingest a hand sanitizer, just call your poison control center, all right? And this is a pretty easy number to remember. I found out when doing my homework. It's 222-1222. Okay, so there's a lot of twos in it. All right, or you could always dial 911 and tell them what has happened, that you have seen someone or might have accidentally consumed some kind of hand sanitizer. Okay, but always best to err on the side of caution and get help or assistance. All right, once again, this was just a short little update to keep us all refreshed on how to keep our hands cleaner and hopefully stop the spread of this COVID-19, and we'll get back to normal, whatever that new normal is, but we want to keep our hands clean and to help stop the spread of the COVID-19 virus. Okay, again, we are the AGEC. We're funded by a Health Services Resource Geriatric Workforce Enhancement Program grant under U1QHP 28723, and we appreciate our funders so much. And thank you, and I'll see you next week.